All right, so we've got this fascinating pile of material all about communication in healthcare. You seem really interested in how doctors, patients, and families can navigate those conversations, especially, when things get serious, when serious health issues are on the table.
Yeah, definitely. These conversations, they can be really tricky. And the sources, they all kind of point to this one thing. There's this power dynamic between doctors and patients that often gets overlooked.
Oh, that's interesting.
Yeah.
It does mention that, like, this imbalance, it can sometimes make patients hesitant, like hesitant to speak up, ask questions, or push back, even when they're not sure about something, even when it comes to their own health. What do you think about that?
Well, it's something that researchers have been looking at for a while now, and it makes sense. I mean, when we're feeling vulnerable, like when we're dealing with health issues, it can be hard to assert ourselves.
Yeah.
We tend to put a lot of trust in doctors. They're the experts, and that's usually a good thing. But it can also mean we don't always speak up when we should. Like if something isn't clear or if we have doubts.
Yeah, and I bet that feeling gets even stronger when you throw in all that complicated medical jargon.
Well, absolutely.
The source even gave an example, like a doctor talking about oxygen saturation
Right.
or drawing blood.
Yeah.
And for someone who's not familiar with all those medical terms, it can be pretty intimidating.
For sure. It can feel like doctors are speaking a whole different language sometimes. And I think they forget that not everyone understands all the medical lingo. It's just so normal for them, everyday talk. But for patients, it can be like trying to crack a code.
Yeah. It's like trying to read those instructions for putting together furniture, right?
Right.
When all you want to do is just sit on the couch.
Exactly.
But how do we get past that then? The source talked a lot about active listening, but it also mentioned that it has to go both ways.
You're right. It has to be a two-way street. It's not enough for just the doctor to listen. They also need to actually hear what their patients are saying, understand their worries, anxieties, what they're going through. The source even suggests that doctors should try asking more open-ended questions instead of just giving information.
Do you think that's realistic, though?
Oh, that's a good question.
I mean, in a busy practice, do doctors really have time for all that?
Yeah, that's a valid concern. Time is definitely an issue in healthcare, but the research shows that even little changes to how doctors communicate can make a difference. It's not always about having these long, drawn-out conversations. It's more about making patients feel like they can speak up, ask questions, and make sure everyone's on the same page.
I see. So it's about quality, not just quantity. And I think that's where this idea from the source comes in, about patients rephrasing what they've been told. It's like a check to see if they really understand.
It
Right?
is, and it's really helpful. When a patient puts things in their own words, it not only helps them remember the information, but it also gives the doctor a chance to clear up any confusion right away.
That makes sense. So it's almost like it shifts the power dynamic a bit too, doesn't it?
Yeah,
Give the patient more control.
absolutely.
Speaking of power dynamics, the source also briefly mentioned how cultural differences can play a role in healthcare communication. Do you think that's something we should be paying more attention to?
Oh, definitely. Culture influences so much of how we view health and illness, even how we interact with doctors. What might seem assertive in one culture could be considered rude in another. The source was making the point that doctors really need to be sensitive to these differences to build trust and communicate effectively with all their patients.
That's a good point. It's fascinating how much we focus on the technical side of medicine, the science.
Right.
But then this human element, like how we communicate, that's just as important.
Totally agree. It's all about bridging the gap,
Yeah.
between what the doctors know and what the patients are experiencing. And that actually brings us to our next point, which is looking at specific techniques that can make these conversations easier. I'm particularly intrigued by this idea of teach back that was mentioned in the source material.
Teach back.
Yeah,
That's a new one for me. I'm definitely curious to hear more about that and how it works.
right.
And why it's so important in these healthcare conversations.
So teach back, it's actually a really simple idea, but it can be super effective. Basically, the patient just explains back to the doctor what they understood from the visit.
Oh.
It's a way to make sure that the information got across and to clear up any confusion before it becomes a problem.
So it's like a double check, a real-time feedback loop.
Yeah, exactly.
Yeah.
And it's really useful when you're dealing with complex medical stuff like treatment plans or medications.
Oh, yeah, I can see that.
For example, let's say a doctor is explaining a new medication to a patient.
Mm-hmm.
Instead of the patient just nodding along, they could actually summarize it back to the doctor. How much to take, how often, any possible side effects.
Right, right.
That way, the doctor can catch any misunderstandings right away.
That makes a lot of sense. Like a safety net to prevent problems down the road.
But how do doctors usually use this technique? Do they, explicitly explain it to patients? Or is it more subtle?
It can vary, but the source recommends that doctors be upfront about it. Explain to the patient why they're doing it.
Yeah.
It's not a test. It's about making sure everyone's on the same page.
Right.
They could say something like, just to be sure we're both clear, could you explain back to me how you'll be taking this medicine?
Okay.
Or, to recap, can you summarize the main points we talked about today?
Those are good examples. So it's about making it a normal part of the conversation, not something weird or awkward.
Exactly.
And it also kind of shifts that power dynamic we were talking about, right?
Yep.
It does, yeah.
It gives the patient more of a voice.
Exactly. By asking the patient to teach back, the doctor's saying, hey, your understanding matters just as much as my expertise.
I like that.
Yeah.
But the source also had some advice for doctors on how to improve their communication skills, didn't it?
It did, yeah.
Like what kind of things?
Well, one big one was using plain language. It seems obvious, but doctors often use jargon without even realizing it.
Oh, yeah.
The source really emphasized that doctors need to avoid technical terms whenever they can and explain things in a way that anyone can understand.
Yeah. Sometimes I think doctors forget that what seems simple to them can be really confusing for people who don't have a medical background.
It's true. It's almost like they're speaking different languages sometimes.
Like,
And it's not just about the words either.
oh, okay.
The source also talked about nonverbal communication, things like body language.
Oh, interesting.
It encouraged doctors to pay attention to whether their patients are making eye contact, if they're nodding, or if they seem confused or anxious.
You can tell a lot from body language, can't you?
Absolutely.
It can show you if someone's really engaged or if they're not following what you're saying.
Exactly. It's all about being sensitive to those cues and adjusting your communication style accordingly. If you sense that someone's hesitant or confused, you might need to slow down, rephrase things, or just ask, does that make sense?
It's about creating a space where patients feel comfortable asking questions, right?
Yeah. Vicky.
Even if they seem basic or silly.
Exactly. Sometimes people are afraid to bother the doctor, but it's really important to ask those questions
It is.
because it can make a big difference in whether they understand their treatment plan and follow the doctor's recommendations.
You're right. The source actually suggested that doctors should encourage patients to ask questions.
Yes,
Like by saying things like, what questions do you have for me?
exactly.
Or is there anything you'd like me to clarify?
That's a much better approach than just assuming the patient understands everything and sending them on their way.
But what about those situations where communication just breaks down,
Yeah,
despite everyone's best efforts? What happens then?
that's a really important question. And it can have some pretty serious consequences.
Yeah, this is where it gets a bit more intense. We've been talking about the ideal scenario.
Right.
But what happens when things go wrong? What are some of the pitfalls?
The source goes into a lot of detail about that. When communication fails, it can affect everything from patient satisfaction to the effectiveness of the treatment. It can create a whole cascade of problems. It really can. The source talks about how miscommunication, it can lead to all sorts of problems, like patients might not understand their diagnosis completely,
Right.
or they might not get all the details of their treatment plan.
I see.
And if that happens, they might not follow the doctor's advice properly.
That's a bit worrying.
Yes.
So they might not take their medication as prescribed or make the lifestyle changes they need to.
Exactly. And that can lead to even bigger issues down the road. The source, it actually mentions a link between communication breakdowns and worse health outcomes.
Oh, wow.
Like patients might end up staying in the hospital longer,
Oh, no.
or they could have complications that could have been avoided.
I hadn't really thought about it like that before.
Yeah, it's serious stuff. And it shows just how important clear communication is in healthcare. The source also talked about patient satisfaction,
Right.
how it can be affected by all of this.
Can you tell me a little more about that?
Sure. When patients feel like they're not being heard or like their doctor doesn't understand them, it can really damage their trust.
Yeah.
And that leads to less satisfaction with their care. I mean, it makes sense, right?
It does. It's like any relationship. If you don't feel like you're communicating well, it's hard to trust the other person.
Exactly. And it can have a domino effect, like patients might start putting off appointments, or they might switch doctors a lot, or even worse, they might just give up on healthcare altogether.
So it's like a vicious cycle.
It is.
Poor communication just leads to more problems, both for the patient and for their overall health journey.
The source even mentioned how it can impact the doctors themselves. All this miscommunication, it can lead to burnout, stress, and even malpractice lawsuits.
Oh, wow. That's a scary thought. It really shows how important it is to get these conversations right. It's not just about passing along information, it's about really understanding each other and building trust.
Couldn't have said it better myself. And while we can't prevent every misunderstanding, just being aware of these potential problems is a good place to start.
Absolutely. This deep dive has been eye-opening, to say the least. I realize now just how crucial good communication is in healthcare. It's not just a bonus, it's essential.
I agree. And whether you're a patient, a family member, or a doctor, you can use this information to advocate for better communication. Because ultimately, that's what leads to better health outcomes for everyone.
So as we wrap up here, what's one key takeaway you want our listeners to remember?
I'd say the most important thing is to never be afraid to ask questions. Make sure you understand what's going on and speak up for yourself.
That's such an important message. Oh, and I love this last tip from the source. It says, next time you hear about a medical issue, try explaining it back to a friend or family member.
Oh, that's fun.
Yeah, it's a great way to see if you really understand it, and it might even spark some interesting conversations.
That's a great idea. It turns learning into a game almost.
Exactly.
And helps us all get better at communicating about health.
Well, that's all the time we have for today's deep dives into communication in healthcare. Thanks for listening, everyone, and we hope you feel empowered to navigate your own healthcare experiences with confidence. See you next time.